Hi, I'm Bryce Russell. This is my presentation on Logan Halbritter. I met him beginning of this past summer after I tore my PCL playing rugby, and he helped me with physical therapy for probably about seven weeks, all the way up until I left for school. So I got to know him pretty well over that time, so I was able to contact him to talk to him about this project. So I asked Logan, like what led him to choose physical therapy as his career, and he said that he always knew his career was going to have to be with helping people, because that's what he really wanted to do. He wanted to make sure he was helping people and making a positive impact in the world, and so he originally wanted to be a doctor, and he majored in biology, and then he realized that he hated biology and all of the classes he was taking, so he switched over to kinesiology. And that's when he found that a lot of his classmates were going to be doing PT, and he realized that that's what he wanted to do too, because it allowed for him to build longer-lasting relationships with parents. And then he ended up getting his bachelor's of kinesiology at UK, and he got his doctorate of PT at Florida Gulf Coast University. So his profession, I asked him what an average day looks like for him, and he says that on an average day he sees anywhere from 10 to 12 patients, and it's pretty fast-paced. He has to multitask with multiple patients. Because of that, he's often double booked like that. He has to keep up with paperwork during the sessions so he doesn't get behind and have to stay longer after. But he likes it because he gets to talk with people during that time and build relationships. Like when I was doing physical therapy with him, I'd be doing my workouts and stuff, and we'd be talking about movies, TV shows, anything like that, and it made the struggles of going through physical therapy a lot easier, because he was able to talk through that time, and that's why he said he enjoys it so much. The next question I asked him was how long has he been in his current position, and if he sees himself doing anything else in the future. He's worked at Court Physical Therapy, which is a big chain of physical therapy outpatient clinics in Kentucky and Indiana, southern Indiana, for 1.5 years. And he told me he would like to try hospital-based or inpatient therapy to see what else is out there and challenge himself and to learn new things. The final question I asked him was, what is the biggest struggle in your job currently? And he said that the biggest struggle often comes from the privatization of healthcare, and the struggle it presents is that it makes it harder for him to provide the best care he can for his patients, because of having to deal with multiple patients at the same time and doubling up like that, and that it's because when corporations prioritize profit over patient care, it makes it harder for him to provide the best care for the patients that they deserve. His advice and recommendations. He told me that whatever you do, make sure that you go in knowing all the pros and cons, so that you know what to expect when the less fun parts of the job present itself, so you're not caught off guard. He also told me to keep an open mind as to what setting I want to work in, outpatient or inpatient, because he wanted to work in outpatient, but during his clinicals really enjoyed working in the hospital. And then after he got his doctorate and is now been working at the outpatient facility for 1.5 years, he wants to go back and work in the hospital again, because he thinks that's where he would feel most fulfilled. I also asked him if he'd ever been through physical therapy himself, and he said he had not, which he thought was different from a lot of the people he knew and was friends with. He felt as though a lot of them had been through physical therapy themselves, and that's why they became physical therapists, which he never went through. I asked him how he ended up at his current job at Court Physical Therapy, one of the locations in Louisville, and he said that was because when he was shadowing, he shadowed at a court facility in Frankfurt, and that turned into a job offer for him to be a PT tech. And after he did clinical rotations at one of their locations, it turned into a job offer for a full-time PT job.